Good evening, everyone. I am Dr. Jeffrey Sterling, Surgeon General of Alpha Phi Alpha Fraternity Incorporated. Let's bring Brother Dion Matthew on. He's our moderator this evening, and I'm so thankful. Let me begin as we bring up Brother Matthew. Let me just begin by acknowledging, as always, the leadership of our General President, Brother Willis Lonzo III, and our Southwest Regional VP, Brother Neville, and our Oklahoma District Director, Brother Clayton. It's good to be with all of you today, and I am thankful for the opportunity to answer a lot of your questions, and let's see how many of these we get through. So, Brother Matthews, are you there?
Yes. Good evening, Brother Sterling.
Good evening.
All right. Good evening, Brother Sterling. Good evening, Alphas Worldwide. We're going to kick off our 42nd Lucius L. McGee Oklahoma District Convention tonight with the discussion from our first ever Surgeon General, Brother Dr. Jeffrey Sterling. We'll basically have a discussion regarding the concerns for men's health, men's mental health, and COVID-19. I am Brother Dion Matthews from the Oklahoma District, and I will introduce Brother Sterling. Brother Jeffrey Sterling is the inaugural Surgeon General of Alpha Phi Alpha Fraternity Incorporated and any D9 organization. He is a 1982 initiate of Northwestern's Alpha Mu chapter and current member of Beta Tau Lambda in Fort Worth. Dr. Jeffrey E. Sterling is the president and chief executive officer of Sterling Initiatives, LLC, a global healthcare consultant with implementation firm and Simcoe, America's first managed preventative healthcare organization championing global implementation of public health best practices for health prevention and promotion, empowering citizens to be better stewards of their health care. He is a public health pioneer. And he's the best-selling author of There Are 72 Hours in a Day Using Efficiency to Better Enjoy Every Part of Your Life. His fifth book, Straight No Chaser Health, Empowering You for Better Health and a Longer Life, is hitting the bookshelves next week. Make sure you guys pick up a copy of that. Brother Sterling is dedicated to enhancing access to healthcare and improving medical services and individual healthcare stewardship for patients, corporations, and nations. Pursuing entrepreneurial initiatives and leadership opportunities that equip consumers with the fundamentals of prevention and intervention. He serves global communities through the provision of expertise, tools, and support platforms that simplify and optimize the practice and business of medicine. Brothers, Surgeon General, Brother Dr. Jeffrey Sterling, SG1. Like I said, guys, he's a pioneer, and he has a lot of pertinent information to share with us tonight.
Let's get it on. That's great. Thank you.
All right. Well, Brother Sterling, we'll just jump right into it with the first question. Is that okay?
Let's do it.
All right. First question is, with so much misinformation being disseminated across this country and people not really understanding what is fact and what is fiction, can you shed some light on the question organizations like ours who may ask brothers before events if they are vaccinated, if that is a violation of their HIPAA rights or not?
Well, respectfully, that's the type of question that someone who doesn't really understand the nuance of HIPAA would ask. HIPAA actually affords you a right to privacy. I guess it's a sign of the times that people would presume that privacy, kind of like the conversations around freedom, is where the conversations begin and ends. But it's not. Your privacy rights actually don't supersede public health, safety, and welfare. My interest as a business owner and our interest as an organization actually allow us the superior rights to discern how to conduct our business. And we can choose to exclude those who pose a threat to the nation's health, which is certainly the case for a pandemic that's based on a contagious infectious disease. So yeah, keep having those vaccination cards as a means of maximally protecting those, because what we don't want to do is to bemoan the fact that we didn't do everything that we could to protect brothers in the event that someone actually has a severe illness and or death. These things happen because incidences are expressions of risk. So it's not a if something happens, it's when. And the best that we can do is make sure that we are able to say we did everything that we possibly could to lower the risk and to produce the best possible outcomes. And I'm so thankful for our fraternity in taking the lead and demonstrating exactly what that looks like, because as you know, during our general convention, we didn't have a single episode of COVID-19 following the very best recommendations of the CDC guidelines. So yeah, let's keep it going.
Thank you, Brother Starling. And I do appreciate you saying that our fraternity is taking steps to prevent those incidents at our conventions, because I remember walking through the temperature thing, and it's amazing what this technology allows us to do nowadays. Yes. All right, brother. I'll ask another question. All right. I know a lot of reluctance to get the vaccine among our community has been because of incomplete understanding of the Tuskegee syphilis experiment. Can you speak to the differences between the two?
Well, first of all, the premise has actually been shown to be overstated. And stay with me on this one, because this is a very good and important question. Blacks have legitimate concerns about the vaccine based on the history of what happened at Tuskegee. But there actually now are several surveys out that show that we have questions more so than an absolute block based on Tuskegee. That's different. After all, that experiment started about 90 years ago and ended some 50 years ago. So there are very few people that actually should be thinking, oh my God, Tuskegee just happened yesterday, let me not take a vaccine because of it. Regarding Tuskegee itself, it's incorrect to continue to advance the myth, and not here obviously, but in other places, that Blacks were infected with syphilis. That didn't happen. Black individuals in that study who already had syphilis were observed over a 40-year period of time so that the study's researchers could learn more about the natural course of syphilis as it progressed. The tragedy is during this time, penicillin was actually uncovered as an effective treatment for syphilis. And that treatment was withheld from the Blacks who participated in the studies. So Blacks weren't given syphilis, they simply had the treatment for syphilis withheld so that people could figure out what happens during secondary and tertiary syphilis over 40 years. Furthermore, this was actually done by governmental researchers, which is why we have this fear of the government. It's equally important, however, and this is something that doesn't get discussed nearly enough. It's equally important to point out that because of the uproar, a long set of new laws, penalties, and other checks and balances were put in place such that you'd have to be an absolute idiot to try something like this again. The development of IRBs, institutional review boards, which is an oversight type of committee that occurs everywhere where a research project gets approved, means this type of research project can never even be approved. And the criminal responsibilities for those conducting research are strong enough that I just can't imagine it even being tried. Now, what saddens me is that even as our angst was legitimate regarding vaccine hesitancy, it was misplaced. Blacks needed to be fighting to get to the front of the line, the front of the vaccine line, not fighting to avoid vaccine mandates. Blacks, the elderly, obese, and the immunocompromised were the communities that were most disproportionately seeing deaths from COVID-19. So we made it easy on the powers that be by focusing on our fears and creating obstacles for our health instead of seizing an opportunity to prevent the furthering of healthcare disparities. Now, I understand the effort to draw a line between Tuskegee and the example of what happened with the COVID-19 vaccines, but frankly, it was just wrong, and it really cost our community tens of thousands of lives.
Yes, it very much did that same thing. So I'll go ahead and proceed with the transition to our next question. Culturally and historically, we've struggled to find safety for ourselves as men. And that is in person, because the same vulnerability that opens you up to help also exposes you for opportunities to be hurt.
Yeah.
What are some practical and tangible ways in which Black men can overcome the stigma that has been attached to Black men seeking help?
Let me start with the question directly, and I'll tell you what my approach is, what I advise patients, and what I do. To start with, as men, we must give ourselves the space to accept a broader understanding of how men act, react, adapt, and evolve. Those are four separate considerations. Since you asked for a practical response, let me offer a comment on each of those four things. Act. Carry yourselves as men simply because you are one. No stigma should be allowed to define your manhood. Somebody teases you, someone bullies you or shames you, you're a man. Stand up for yourself. This is your life, and you will do better and maintain better mental health by owning your space, your environment, your life, and how you move within the world. So learn how to act. React. Now, I'm actually less a fan of reacting than responding, and that's a distinction with a difference. If you stay ready, you don't have to get ready. Better equipping yourself to respond to challenges allows a more measured and a more controlled response than reacting, which tends to be more haphazard and sometimes emotional. Just think about that for a second. Let's condition ourselves, train ourselves, and work on responding to situations instead of reacting. It's a measure of control. Adapt. As I said, I'm very big on controlling your environment as best you can. But when you can't, you likely can still adjust in a way that allows you to operate within your strengths. So you'll see a constant here, and we'll talk about this on some other mental health questions if they come up. The more you are able to maintain control in an environment and on your environment, the better off you're going to be. So try to adapt to situations where you're still working from a position of strength. And fourth, evolve. There's always another level. We should, as men, should be striving to live within our strengths, even as we work on our weaknesses. Growth is strength. Do you want to be a better, stronger man? Well, add the skills of acting appropriately, reacting with strength, adapting to environments in ways that are productive. And if you do those things, that's evolution, that's growth. You will have created an ongoing growth curve. Think about it. See if you can put those things into play.
Excellent, excellent. Thank you, Brother Dr. Sterling. So now I kind of want to ask about the COVID-19. Coronavirus has disproportionately affected Black, Indigenous, people of color. Racial and ethnic minority groups are at a higher risk of getting sick and dying from this virus, according to the CDC. How can we reduce COVID, the COVID risk?
Well, this question is great, and it's timely as the nation debates if, how, and when to end mandates. You're seeing a lot of states now roll back the mask mandates. And, the point here is that that's not an indication that things are getting better. It's just politicians following the will of the people and giving in to hesitancy. But still, it was never about a mandate, but it was about common sense. And we, the people, actually at this point already know what to do. I call these things, the W's. But let me just point out some things that answer the question about what to do. The reason why you wore a mask wasn't about a mandate, as I said. You wear a mask to avoid transmitting the disease, right? Because if you are infected, the mask provides 94 to 96% protection against spewing viral particles onto someone else. If you're double masked, you get 96%. So that's why you wear a mask, okay? Now, I actually, for at least 10 years, I've been telling people, forget how you look. If you have allergies, if you have asthma, if you have reactive airway disease, and many other types of things, We see in international airports all the time, people from Asia, for example, have always worn masks. It actually makes sense to do that because it protects things from getting into you and it prevents you from spewing things outwardly. So wear a mask. That's the first W. Secondly, and I should have said this first, watch your distance. And the way these things work, particularly the virus that causes COVID-19, we know that the projectile space between someone who has it and them talking to you, singing, coughing, sneezing, blowing is 6 feet. So you watch your distance to avoid getting the disease. Because if you're more than 6 feet apart from people, it's not going to get from them to you. So you watch your distance to avoid catching the disease. You wear a mask to avoid transmitting the disease, and you get immunized to prevent dying from the disease. Now, if you have a knucklehead friend, knock him upside the head and say, stop talking about, well, I got the vaccine. And this was true for the flu as well, completely different disease. But it was always true that you never got the flu vaccine to stop you from getting the flu. You stopped it from dying from the flu. The same is in place with COVID-19. So let's take a second and drill a little bit deeper on that point. There is nothing about a vaccine that is going to stop somebody who is infected, who is within 6 feet of you, who is breathing on you, from stopping that respiratory droplet from getting into your nose or your mouth and down your lungs. How can a vaccine possibly have ever done that? What the vaccine does is internally strengthens your immune system and prevents the worst outcomes of the disease itself from occurring. So stop it with the vaccine didn't prevent me from getting COVID. It stops you from dying from COVID. And it is incredibly effective at doing that. So back to the question. If you really want to just be smart about this, what you need to do is watch your distance, wear a mask, be immunized, and the other W would be warn others if you develop symptoms. Because the truth of the matter is that for so many of us, it's not us that are going to die. If you are young, healthy, have a robust immune system, the chances of getting a deadly case of COVID-19 are admittedly ridiculously small. However, as long as you keep it in the environment, somebody's grandmother, someone's family member who has a lower immune not talking about HIV, we're talking about things like lupus and even someone who's a recovering cancer survivor. People who have lower immune systems for various reasons are the ones who end up dying. The elderly population with a naturally diminishing amount of immunity, et cetera, et cetera. So really, as long as you are not being selfish, you need to be concerned enough to do things that may seem inconveniencing, but they really aren't. And as we move out of the era of mandating masks and other things, all of these things that I've just talked about are still things that you can and should be doing. Anytime you are with a group of individuals and you are within 6 feet, why not put on a mask? When the opportunity presents and you're socializing, why not maintain 6 feet of distancing between things? We've learned for years that, for measles, mumps, rubella, polio, smallpox, so many diseases have been prevented over the years by getting the vaccine. We're not asking you to do too many more things, but the cost of freedom or the cost to get your freedom back really is to try to lower the bolus of the virus that's in the community as much and as quickly as possible, because keeping it in the environment simply allows these ongoing variants and mutations to occur, or the fear that we're going to get something both as deadly as Delta and as transmissible as Omicron. And that could actually reset the clock and we'll find ourselves in the same situation all over again. So just remember the W's and you really can lower your risk. And remember, this is a game of lowering your risk. There's no guarantees. Even if you have a 99% chance of being protected in 1 out of 100 cases, it still is going to manifest itself. So see, you can try this at home. See if you can maintain distancing and mask wearing in appropriate situations.
Oh, yes. And 94 to 96% protection is better than absolutely zero protection at all. So I advise everybody, wear your mask. Wear the mask. All right, Brother Sterling. We're going to transition to a question about Black men's health, mental health. How do social conditions like racism, segregation, and discrimination affect Black men's health?
Sure. You're describing what we call social determinants and influences of health. Institutional and structural racism have been here since we got to this continent and continue to manifest in diminished health for Blacks. But as the question suggests, and we don't talk about nearly enough, Black men especially. And let me just start by saying, with all due respect to our sisters who may be listening, Black women, you may be surprised to learn that Black men have a 5-year lower life expectancy than Black women. Black men, out of each of the top 10 causes of disease in the United States, Black men have worse healthcare outcomes than Black women. Black men, as a demographic, have the worst healthcare outcomes across the board in this country. And a lot of that is tied to social determinants of health, notably structural racism. One of the things that I really don't care for is this whack-a-mole approach to medicine, where there's a disease like COVID-19 that pops up and we try to whack-a-mole and say, let's make sure that we're fair and that nobody is disproportionately affected by COVID-19. But the underbelly of the entire healthcare system is akin to not being able to pull yourself up by your bootstraps because you don't have boots. You know, the truth of the matter is that our communities tend to be in environmentally non-conducive areas. And I'll tell you what I mean by that. 2 quick examples. If you've ever heard the term medical or health deserts, imagine if I live in a place where there's no physician's offices, no hospitals, no pharmacies, and I get sick. I have to travel so much further, take an entire day, and if I'm impoverished, I have to take a day off from work. It's really a big deal to try to go get cared for. And that can be counterproductive. And that's the type of thing that happens disproportionately in Black communities. Similarly, we've all heard the stories about environmental toxins. You know, let's just think about where Flint, Michigan is and what happened with the water supply. You know, whether there's the electrical currents in the lines or the poisoning in the lead. These things disproportionately happen in Black communities. And as these things go, in the Black family, Black men are disproportionately affected than Black women because we don't engage, in large part, the healthcare system. Well, you know, OB-GYN exists, and women get well checks or routine checks once or twice a year, and it's quite normal. Black men really statistically don't seem to engage the healthcare system until their mid-40s. And that means that whatever is wrong with us has a lot of time to cook inside of us. So part of what I want to focus on in these questions is not just, with all due respect, things that are being done to us. We're not going to just accept victimhood, but we're going to demand responsibility for the things that are being done to us that need to change. But I am a huge proponent of us being empowered and finding ways in which we can engage in preventive measures that still us when these other social determinants and influences of health come to bear. So it is always true, and I talk about this across the board, whether it's in my books or in conversations like this. Brothers, please remember, an ounce of prevention is always worth a pound of cure. You always want to talk about diseases and how we can get equitable treatment for diseases. The better way to have a conversation is to talk about health prevention and health promotion. Stay ready so you don't have to get ready. Avoid the disease so you don't have to treat the disease. This racism conversation is a 4 or 5 hour conversation by itself. These social determinants of health are real. If we don't have money, we can't pay for medicine. Families are having to choose between food and prescription medications. It goes on and on and on. Let's just focus on what we can do to strengthen ourselves while we fight the powers and fight the system to rebuild a healthcare system that isn't rotten at the core and that is equitable at the beginning of the conversation.
Great. Thank you, Brother Sterling. Next question. Over the past 2 decades, for sure the past few years, there has been growing interest in improving Black men's health and the health disparities affecting them. Yet, the health of Black men consistently ranks lowest in nearly all groups in the United States. What do you feel is the cause of Black men continually ranking low?
Well, we just talked about that. Now, lad, since there's another question on it, and brothers keep asking the questions, these are some great questions. Let's get into it. The bottom line is that this dovetails into the other conversation about being a man. Think about your fathers or your grandfathers as best you can and best you can remember. We are the ones that sacrifice for the families. We are the ones that forego considerations of health so that the entire family can eat or get treated and other such things. We don't get taken care of, as I mentioned, until our mid 40s. If we're sick, we shake it off. We man up. If we have mental health challenges, we don't address them. That's part of being a man. So much of what is illness and mental illness for others, Black men haven't had the space to embrace because it's just part of being a man, taking care of our families and our community. It is in some respects, quite honorable way to have lived the last 4 centuries. But on the other hand, it's time that we stop taking that on our shoulders in total and demand better for ourselves. Because, I've mentioned the disparity in life expectancy between Black men and Black women. But if you actually extrapolate that over to white women, we're talking almost 10 years, about 10 years life expectancy between being a Black man in America and a white woman in America. We can do better, and we have to not only demand better, but we have to empower ourselves to take the steps that will get us there. And I'm so thankful to Alpha Phi Alpha for embracing this Surgeon General initiative, because don't get it twisted. That is exactly what we're looking to do with our group of men, our families, and the communities that we serve.
Excellent, Brother Sterling. And I'll tell you a story. Apparently, I've had asthma my entire life. Didn't know it. You know what I'm saying? So I'm almost 40. So my wife makes me go to the doctor. You know what I'm saying? Now more than ever. And come to find out, I'm allergic to almost everything outside. Now imagine a kid playing football, running track, having issues breathing, not knowing, you know what I'm saying, I've got asthma. And coach is telling me, "Oh, you're fine. Just run it off. Just run it off." And
Right.
you know what I'm saying? When I'm around my family, I can't breathe. They just, "Oh, go drink some water and sit down and be still for a little bit." You know what I'm saying? I think sometimes we should probably start addressing those issues with kids earlier in life, because we didn't have the money, for me to go to the doctor every time something was wrong. So I think we just have to be more diligent with our kids.
Yeah, well, one of the things, let me follow up on that. One of my many taglines is knowledge is health. And in that particular example, this is a very simple thing. Allergies actually kill people, folks, more often than you might think.
Yes.
And the simple step of having a primary care doctor, and then having your primary care doctor run an allergy screen for you. Allergy panel, and finding out to what you're allergic, and then placing you in an environment where the risk of your running into those allergens are minimized. I can tell you right now, I actually deal with seasonal allergies myself, and I don't care what you think. When it's that time of the year when those particular pollens are heavy in the air, you're going to see me walking around with a mask, and you can laugh all you want to, but I'm one of the healthier guys you know. And that's just the level of proactivity that needs to occur. Starting with knowledge, you need to know what it is you're up against. If you don't know what you're allergic to, then there's no way you can effectively deal with that, unless you're going to be in my emergency department on the business end of a endotracheal tube, protecting your airway. So we can do better than that.
Oh yeah. I take allergy pills, and I have to carry around EpiPens wherever I go, just in case, something takes a turn for the worse. All right, we appreciate you, Brother Sterling. Mental health has become a hot button topic recently. Can you discuss some successful treatment types for Black men, both traditional and innovative treatments?
Well, see, there you go again. And every time you do this, I'm going to pull you back. The question was, can you discuss some successful treatment types? But I'm the prevention guy. See, I'm an emergency physician, so you don't want the type of treatment that I'm going to talk about. Because if you come into my emergency department with a mental health challenge, the types of things that I'm empowered to do aren't going to end well for you on a relative consideration. I will continue to emphasize that we need to strengthen our coping skills, our support systems, our knowledge of how to put ourselves in positive and affirming environments, right? You have to learn how to be ready so you don't have to get ready when those stressors come and pose a challenge for you. There is no treatment out there. And again, we have just a fantastic mental health subcommittee. We have 6 subcommittees in the Surgeon General initiative, and our mental health team is just phenomenal, as they all are. But there's no treatment out there. And we'll talk about treatments, I'm imagining. But there is nothing that you're going to do that's going to be better than the development of coping skills that actually provide tougher armor for you to guard against mental health challenges. Now, I'm not talking about individuals that have chemical imbalances and those need to be corrected. I'm talking about these days, everybody has trauma, right? And I actually read an article in the New York Times yesterday saying, my God, if everybody has trauma, does anybody really have trauma? Well, again, the truth of the matter is that everyone does have stressors, but we're living in a society now where PTSD is a real thing and people are more free to express that. But the situation for us remains the same. Just as our fathers and grandfathers necessarily had to be strong, I am saying today the substitute for that is not going to be medication. It's going to be developing better coping skills. You can't just suppress all of your mental health challenges. That's not what I'm advocating at all. But we can learn how to reduce stress, how to manage stress, how to have support systems that can be with us during our times of stress, and that'll prevent some of the nefarious things that go on. You know, in America, we've literally gone from electric shock thinking to lobotomies over the years. Treatment is a slippery slope, and I'll answer the question if you really want to go down that path, but there's some things that are so much better, and I want that to be the focus for brothers. Now, if there are brothers who have specific mental health challenges, and you want to talk about that, that's fine, but I think in the big picture, given that we're not talking to an audience of individuals who have mental health diagnoses, the better conversation really is to focus on the types of things that we can do to support each other and to still us from the mental health challenges that we face every day.
All right. Thank you, SG1. All right. In a few weeks, we will be making mental health known with the National Mental Health Awareness Month. Let me ask this. Traditional ideas that are tied to Black masculinity, such as not crying, like you mentioned earlier, being tough, not showing emotion, have caused many Black men to struggle with being vulnerable and open about mental health challenges. What are some practical ways we can eradicate this disease of not seeking mental health in the Black community and not be so reluctant to making mental health a priority?
Traditional ideas that are tied to Black masculinity, such as not crying, being tough, and not showing emotion. I don't want to answer this question in a way that tells people that I am encouraging you to go outside and cry and not be tough and show emotion. I think that the tool set of being human, of having all of your emotions and mentalities available to you to use appropriately is a real thing. What we don't want to do, quite frankly, and again, I'm willing to be wrong on this, but I'm going to try real hard not to go overboard, is that the pendulum doesn't need to swing from men being hyper masculine to being hyper feminine, with all due respect. And I know that's not the same as saying that there isn't a point in place in time where crying is or isn't appropriate, where being less tough doesn't need to be the first response, where it's inappropriate to show, no, none of that. I want to get back to the point I made previously. Build your tool set. Of course, there are points in time where you want to emote, and that's a full day, that's being a full human. But we can't use these things as a crutch. We don't want to be weak necessarily. That has nothing to do with masculinity. That has to do with being effective at what it is you do. Women out there have the same challenges. So if the question is, what are some practical ways that we can eradicate this disease of not seeking mental health? Men, give each other the space to emote when appropriate, to not have to be tough, preferably because we have a great organization like this where you have someone just a phone call away who can have your back, where you can be open about talking about mental health challenges like we do in the Surgeon General Initiative webinars that feature mental health. Communication, conversation, and knowledge are ways to understand not just when it's appropriate to act certain ways, but what are great coping skills and where your resources are, how to strengthen your family, your support system, and your network so that hopelessness isn't the response and you feel as if you need to cry because you're being overwhelmed by a challenge. At every point in time in these conversations, I'm going to point out to you that long before you get to the point of things falling apart with these mental and physical health challenges, there are things that you can do to actually develop better skills, preventive health, preventive mental health. That's what coping is. So focusing on those things are fine, but in the short term, some of the most practical things you can do is to have a circle of friends where you just check on each other. You know, there's so many crazy memes out there, but some of the ones that actually ring true are that, you know, check on your strong friends, because the people that are so busy taking care of everyone else very often are the ones that don't have anyone checking on them. It's okay not to be okay, but just talk it out. So what I'm wanting to try to do here is to make sure that we understand that the range of human emotions is there to be used appropriately, but let's stay with each other. Let's make our toughness and our strength as men a group consideration so that we don't get stressed out or overwhelmed by having to take on too much ourselves. And that's a very practical way. Simply put, let's have each other's back and do better at doing that before, and let's not be afraid to embrace each other and to share each other. That's what the spirit of fraternity is, and hopefully that's what we do well in our fraternity. Let's extend that to our families and our friends and to our community in general. I think it'll work.
Most definitely, Brother Sterling. When I was sick, I mean, the amount of brothers that called me, that called my wife, sent her text messages, just, you know what I'm saying, what can we do? Can we bring some food by? You know what I'm saying? So when I tell people about Alpha, it's like I tell it from the heart. I always tell that story of like, you brothers didn't have to reach out to my wife when I was sick. You know what I'm saying? They didn't have to reach out to me, but everybody took time out of their day to make sure that I was okay. You know what I'm saying? And that really meant a lot. And it also helped me mentally as well.
But let me back up for a second, because, you know, one thing that we don't do well, and this is, I promise you, all day, every day, this is me. The concept of mindfulness. If this isn't on the tip of your tongue, and if you're not thinking about it, you're really missing out, because we have to take inventory of who we are, whether it's as a man, whether it's as a father or husband, whatever the situation is at our jobs. The more in tune you are with who you are, how you operate, what your strengths are, what your weaknesses are, it gives you a platform to build on. So whatever it is you do, whether it's prayer, whether it's yoga, whether it's meditation, whether it's physical activity, a lot of people use that as their release. Take time to check in with yourself. And, you know, you mentioned my first book, there are 72 hours in a day. Every single day, by far, my best days and my most productive days are typified by two things. One is health. Nobody's best day ever was ever a day where they were sick. And secondly, is that you actually engage, preferably at the beginning of your day, in some degree of mindfulness. And what that means is, what am I going to do today? What are my goals for the day? What are my outcomes for the day? Where's my mentality for the day? Am I in a good place? Because the answers to those questions help you navigate. If you're not in a good place today, there are some activities that you may not want to become involved in. If you're feeling strong, there are some things that you might want to get at. So I love mindfulness, and it really is key to my entire quest of productivity, and it actually informs the level of mental health that I walk through my day with, because I'm trying to do so with purpose. And there's so many ways in which we can offshoot that particular conversation, but Just think about it. I describe this in one of two ways. You don't want to be a butterfly fluttering around that's aimlessly trying to find something to pollinate. That's not a good way to live your life, in my estimation. The extreme to that is you don't have to necessarily be a raging bull that's just following anything that's read, but a requisite and appropriate amount of mindfulness can really guide you. Live a purpose-filled life. Think on what things are important to you. Begin with the outcome in mind. What makes you happy, what makes you healthy, what makes you complete, and go follow those things. But it really does need to begin with that mentality that this is who I am, this is where I am, this is what I want to do, and this is how I get there.
Excellent. 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 I'm going to ask another question. The pandemic has forced many people to now have to work from home. Our natural daily movement has been drastically cut. As we figure out how to intentionally get back into better shape, we know that diet is important. Can you speak to what kinds of food we should stay away from with the slowing metabolism now?
Yeah, I wish we were having this conversation a week or two from now where you had read my book, because there are several titles of chapters that speak to this entire point. So I'll just talk about some of those. There are like 3 or 4 different topics in this one question. So let me just focus on a couple of things. You can never out-exercise a bad diet. Okay, I'm going to say that again. We talk so much about diet and exercise, and it's for a reason. You can never outwork a bad diet. And actually, diet is about 75% of the health equation. And I actually do the math in the book to show you that if you're trying to lose weight, diet is really 75% of what you're going to accomplish to cut calories and downstream produce health. So I'll start with the end of the question. Don't worry about the types of foods that you should stay away from at the beginning of the conversation. I want to talk to you about how to eat more healthy, because it's a very simple conversation. Then I'll come back to the other. Remember, everything you eat, another chapter, everything you put in your mouth either helps or hurts you. It's truism. Mouth, nose, and lesser extent your eyes are gateways to everything happening inside of your body. So everything you put in is either going to help you or you hurt you. What we have seen around the world in countries that have the highest quality of life and the highest longevity of life is the closer you move to a plant-based diet, the more healthy people are going to become. People don't have fancy Pelotons or gym memberships to produce the longer lifespans. Nothing against it. Do it myself. Absolutely love it. But this is actually a very simple conversation. And the closer you are to a plant-based diet. Do you know what a semi-vegetarian is? Somebody says semi-vegetarian. Ooh, that sounds horrible. I don't want to be a vegetarian. Well, again, just get rid of the red meat, chicken, turkey, fish. If you do that, you're a semi-vegetarian, and you're going to be dramatically more healthy than you would otherwise. There is a thing, I spent a lot of time talking about this and want to refer brothers to it. It is called the healthy eating plate. Go Crimson, that came from Harvard School of Public Health. And very simply put, the last part of the question, avoid anything processed. We now know that processed meats actually cause cancer. Forget about it. If I were just going to give you 2 tips that are going to get you 50% of the way away from eating healthy, and I want to be respectful and actually answer the question. Get rid of processed meats because they cause cancer. And secondly, avoid sugary drinks. Okay? Water is a beautiful thing. As a matter of fact, I'm here to tell you, the healthier you get, the more your body will crave water. The more you drink anybody's soda, pop, whatever you call it, 150 calories all day, every day, every time you drink a pop. That's adding calories and high fructose corn syrup and all the rest of that, which is not healthy for you. Anything that you are drinking that has added sugar in it ultimately is going to produce obesity, produce diabetes, and other types of bad health. So for that part of it, stay away from it. In the interest of time, processed foods, and yes, I mean bacon. Yes, I mean hot dogs. Yes, I mean hamburgers. Yes, all your favorite things. And you guys don't sleep. Some of the stuff that are being made as substitutes are kind of catching up. And I know we have a lot of grill masters out there that know how to season foods appropriately. Use those skills so that you don't have to consider yourself some health nut. There are ways to help yourself without having to be ridiculous about it. But in terms of getting back in shape, it really is about, this healthy eating plate. Half of your plate should be fruits and vegetables. I got to the point where I actually only eat desserts now about 4 times a month. But when I eat it, I love it. But it has to be something I really enjoy. I am mindful in my food selections. I just don't shovel food of any type in my mouth anymore. I have to really want it. So, and I even eat fruits, sweet fruits for desserts. That's how I get my sweet tooth in. And then, if half of your plate is fruits and vegetables, then you have something that's the size of your fist for protein. And then, of course, you need carbs, et cetera, et cetera. Check in on if you actually go to YouTube or the Fraternity site, we've had some wonderful conversations on how to eat healthily, more healthy and appropriately. There's a lot in there, but I'll give you a couple of tips that I think will go a long way. But yeah, let's stop there in the interest of time and more questions.
Okay. All right. Thank you, Brother Sterling. Next question. Another indirect result of COVID has been non-COVID related appointments being pushed or canceled altogether. As a result, many men are not seeing their physicians as regular as they should, myself included. As it relates to our health as men, what are some preventative measures we can take to be better prepared for favorable outcomes when we go in for colonoscopies?
Well, that was a leap at the end. You go straight to the colonoscopy, huh? This is so, brothers, trust me on this one. This is so much more simple than you would want to believe. And again, at the end, I'm not plugging a book. I'm really talking about health. At the end of this, there are appendices. And one of them is just 10 or 15 steps that actually translate into a fountain of youth. And they're very simple steps that we all can take to protect our health. Because at the end of this, it's really, the world is toxic and we're exposing ourselves to toxins. You don't want to get skin cancer? Put on some sunscreen. Wear a hat if you're out there golfing or doing something at the beach. These things are simple. Don't drink. The recommendation, men don't have more than 2 drinks a day at a time, and women more than 1 a day. You don't have to get liver cirrhosis. By far the most common. Again and again and again, I can point to things that translate into why we have the diseases that we have. Your heart is just a pump. And I'm going to have a hypertensive conversation right now. Your heart, all that emotion, I know we're coming up on Valentine's Day, but I don't want to break anybody's heart here, but your heart is just a muscle. It's a pump that serves the purpose of contracting and relaxing to swish blood around the body. And it's like a roller coaster. The blood carries oxygen and nutrients and other supplies. Now, if you are at your ideal body weight, and I know Black folks hate conversations about BMI, trying to pretend like it doesn't apply to us. Spoiler alert, it does. But the truth of the matter is that your heart is this muscle. And if you weigh 150 or 180 pounds, that muscle has less work to do pumping around the blood to keep you healthy, getting oxygen and food to your cells, than it is if you weigh 300 pounds. Imagine the work that your heart, you only get one heart, and your heart isn't being strengthened by getting bigger and bigger. It's preparing to fail when it does that. What it does is we talk about being slow and low. If you check your heart rate and it is low, or if you check your blood pressure and it is low, those are efficiency measures. That says that your heart is able to contract once and swish it around. It doesn't have to contract as often to get it around. So a measure of health is slow and low on your heart rate and your blood pressure. So if you develop high blood pressure, if you develop diabetes, the things that afflict us so often, so many of these diseases, and you haven't heard me talk about medicines yet, because so much of what we need to avoid disease and what we need to remove disease from our lives is to be found in our own hands. We have the ability through diet, exercise, stress management, mindfulness, to pull back on the stressors, physical and mental stressors that produce disease, that worsen our immune systems, that trouble our hearts and brains and cause heart attacks and strokes. So if you simply, to answer the question finally, if you simply did diet if you move today closer to a plant-based diet, eat a salad every now and again, eat less of the fat and the pork and the things that you know are not good for you, Any step you take incrementally is going to improve your health. One of the other things I say, I don't even talk about exercise anymore. I talk about activity, because every measure of activity that you take improves your cardiac function. So if I was not on a screen right now and I was just having this conversation on the phone with Brother Matthews, I'd be up pacing. I get in about 7 or 8 miles, literally 6, 7, 8 miles a day walking. You don't have to get in the gym and do all of that. There are different levels, and you produce different activities by exerting and getting your heart rate up. But any activity actually strengthens your heart and produces greater health. So, one of the tips that I promoted that was very well received from the first book is that when you're watching your Super Bowl or other games, do so on a treadmill, because your adrenaline rush is already there. Be active as much as you can. Go throw a football with the kids, frisbee, shoot some hoops. Any level of activity is producing health, so that when you go for your colonoscopy, if you have a diet that is more healthy and more plant-based, we won't have to talk about colon cancer, which is entirely based on the Western diet that's filled with all these processed fatty foods.
Thank you, Brother Sterling. I'll be eating a salad for dinner tonight. Thank you very much. No, for real. All right, last 2 questions. Just a common question that may be of value not only to our community, but also our college brothers walking on these campuses with little to no protection for them. I believe a pertinent question for them, who is at risk the most for COVID-19?
Yeah, see, that's a trick question. You're not going to trip me up on that one. So the way I answer those questions, because knowing that younger, healthy individuals are not as likely to die from COVID-19, because that's what a lot of people will say, right? I'm not going to die from COVID-19 even if I catch it. The way that I answer that question is you and your families. Because you can be a carrier of COVID-19. You can literally be infected with COVID-19 and be asymptomatic. And you can then go visit your loved ones, your elderly loved ones, infect them, and they will die. So it is part of your responsibility to not only protect yourself, but protect your loved ones if you care to do so. So I never tell people that you're okay because you're not in the high risk group. I tell them that if you choose to care for your loved ones, here are some very simple things you can do to lower the risk so that we can lower the viral load in the population and stop our parents and grandparents from dying from this disease. But I talked about the groups before, the elderly, the obese, anyone with a disease that defines them as immunocompromised. And African Americans, there are many parts of the country where we are dying at twice the rate of the general population. So we have all of these comorbidities, the hypertension, the diabetes, and other immune suppressing diseases that put us at a higher risk just because.
Definitely. I definitely agree. Definitely agree. All right, last question. All right, are there any substantial correlations that together medication and therapy are major beneficiaries for our community as it relates to mental illness, or is one better than the other trying to combat mental illness?
Yeah, see, there you go again. And I bet you if this was a panel and everybody in the audience was polling, you'd get this answer wrong. And if you've been listening to me for the last 50 minutes, I bet you'd get the answer right. So what I want you guys to know is that, believe it or not, when it comes to mental health, as is the case with so many of these other diseases, medications is not the answer. I'm going to say that again. When it comes to actually treating mental health, psychotherapy is better than mental health, and the addition of medication onto psychotherapy doesn't really add that much. An ounce of prevention is worth a pound of cure, my brothers, even when it comes to mental health. Developing these coping mechanisms, your support system, and your armor of ability to adapt, appropriately react, appropriately act, and navigate throughout the world and evolve to a stronger, higher person is how you get all of this done. So I don't know if you were trying to trip me up with that last question, but it's the same as everything else. Health is not an accident. Health is a habit. And that's true for mental health. We know it's not a if something bad happens, it's a when something bad happens. And we have to do it today. prevent ourselves from overreacting or inappropriately reacting when those stressors, both physical and mental, come in front of us. We can do this, and we will protect each other in this fraternity and our families and the communities we serve. I think that we're going to be a better group of men for these types of conversations. And I just strongly commend your district for wanting to have this conversation. And I hope that the information that we've presented has been well received and received in the spirit in which it was attended. We don't judge. We just want to treat, and we want to empower our brothers to be better stewards of your health care. And we will continue to do so. To any other brothers that are out there listening, we want to help. We want to make everyone stronger. We want to give you the tools to do the things that work for you. If you're into holistic medicine, if you're into other alternative considerations, we can talk about all of that. Just send us a request. We have these conversations every other week. We're back on our regular schedule next Thursday. Please email me at surgeongeneral@apa1906.net. I'm just very willing and pleased to be able to be with the Oklahoma district. Thank you for inviting me. And I see we're coming up on the hour. So Brother Matthews and the rest of the district team, on behalf of the entire Surgeon General Initiative team, and of course, Brother General President Willis Lanza III, this has been enjoyable. And yes, Thursday, a week from today, same time, 6 p.m., our next conversation is a mental health topic, actually. It deals with love, relationships, and mental health. It's going to be invite your favorite female friends to get in on this one, because we're going in. Our mental health team has a great lineup for this one, and we do this every other week. You can check the fraternity page, Sphinx TV, etc. We're here for you. So thank you, and we embrace starting on time and ending on time. And with that, I will say good night. 06.
Good night. Good night, Brother Sterling. We greatly appreciate you.
Thank you. Thanks for having me.